Mercedes, could you turn off the ding dong noise when people enter?
Yes, it's off. Thank you.
Okay, let's start. Hi, everybody. Thank you for coming. We have seen over the last year plus just an absolute explosion of the use of mobility data of the kind that we all have been working on through the COVID-19 Mobility Data Network and now at Crisis Ready. And I think we all here recognize how powerful these data streams are and sort of unprecedented in recent history for trying to keep tabs on where everybody is and where they're going and what that means for being able to parameterize models for epidemics, but also keep track of people in the context of natural disasters and for policy and planning purposes. One of the things that we've emphasized throughout the last year and a half nearly is that these are only very rough proxies. We know these data sets are biased. We know that they are spatially uncertain and are aggregated in ways that create noise and uncertainties about exactly who's being captured, the motivations for some of the dynamics that we've seen. And I think a really important next phase of using this kind of data, especially in the context of decision making, is a really sustained, systematic and rigorous effort to ground truth some of the data streams that we have, and to try to think about ways that we validate them, and what that means in terms of social justice issues or trying to make our models more robust, and so on. And so today I'm delighted to have two former CCDD colleagues here to talk about their work. Both Pamela and Amy we were able to support through small grants through Crisis Ready, thanks to our Schmidt Futures and Facebook funding. And today they are going to discuss some of their work on this really important issue. So I think we're going to start with Pamela Martinez, and then we will go to Amy Wesolowski. I won't introduce you, but maybe you can introduce yourselves. I believe Stephen Klipman from Amy's group is also going to be presenting today. And then we have Nishant Kishore, who is at Crisis Ready and a graduate student at Harvard, is going to be a respondent in a discussion. So welcome, thank you for being here. And I guess, Pamela, do you want to begin? And then we'll go to Amy and Stephen.
I have had volunteer Amy, but I guess you volunteer me, so it's fine. I can start.
I don't think it matters what you want to go in.
No, I can start, it's okay.
Okay.
So I will introduce myself. I am an assistant professor in the Department of Microbiology and Statistics at the University of Illinois Urbana-Champaign. I'm also affiliated with IGB, that is an Institute for Genomic Biology, and I am excited to work in this kind of very collaborative and interdisciplinary research. So let's see. So today I'm going to talk about the work that we have been doing in Chile. Chile is my home country, and using this mobility data that Facebook gave us access, we realized that it was an important tool to understand the current pandemic. And we have also realized the limitations of the data. So I will discuss both, kind of the pros and the cons of the use of Facebook data in particular, in understanding the current situation in Chile. And I'm going to start with the motivation, because early on last year, when Chile was in the middle of the first wave crisis, I saw this news and I was like, Chile's biggest copper mines output rises despite coronavirus. And the mines are kind of one of the main income source for the country. And I was surprised because here on the left, I am highlighted Santiago, the metropolitan region. So Chile is a very long and skinny country. And here is Santiago. I don't know if people can see the pointer. Can people see the pointer?
Yep.
Yes, okay, thank you, Amy. So these mines are in the north, and they are very far, like you have to take an airplane, you cannot drive there. So I was surprised to see this news. And then, well, a little more of context, like is one of the mining sector is one of the pillar in the Chilean economy. Copper exports alone stands for more than 1/3 of the economy of the country. And most of them are, as I mentioned earlier, located in this north region. So the size of the pie represents the amount of money that it creates. And the colors are like the ones that are in orange are copper, mostly copper. So you can see that they are very like, well, this is a country, the map of Chile divided in two because it's too long. But you can see it's very focused on the north. And then just doing kind of a preliminary exploration of the data, I explore the movement from Santiago to the rest of the country. And I was very kind of puzzled by looking a lot of movement to this region. Well, I wasn't that puzzled if we consider the news that says that the activity continues throughout the year. But this reminded me the work, for example, that Amy and Aisha Mahmoud have done in the past to show that many times the gravity model doesn't necessarily explain the patterns of mobility in a particular country or region. And here it's clear that a place, an area that this in particular, let me annotate. So here, these regions here are, these are provinces that are not that big and they are far from Santiago, which is the main city. Santiago has like 1/3 of the entire population. So looking at this mobility to these places that are far and small kind of made me think about this. Okay. So how do I, okay, there we go. So then, as I mentioned, oops, I need to clear all my draws. Okay. So let me go back. So these are the probabilities, right? We normalized it so that the probabilities go from 0 to 1. And these are the probabilities to go from Santiago, that Santiago is located. These are sorted from north to south. All the provinces are sorted from north to south because it's very skinny, the country. So Arica is the very top on the north, and then Magallanes is the very top in the south. And Santiago is located here near Valparaiso. So you can see that there is still some traffic to the north and the south, even though they may not be so close or so big. And these are the probabilities of like that we will expect using a simple gravity model. And the gravity model takes into account the density or the population of the location A, like from and to, and then it divides it by the distance. So again, places that are farther and smaller will expect to see less movement. So what we can do is to kind of see what is the difference now between the data from Facebook and the gravity model. And here I'm showing this difference in this kind of reddish colors. We see negative difference, which means that the probability of the gravity model is higher than what we observe, meaning that probably the reduction of movement during this period of time, this is data from 2020, people were moving less than expected by this null hypothesis. But here, well, the color doesn't help me that much, but you can see green colors that reflects the positive values. But we can highlight it now if we only focus on the positive values and kind of ignore for now the negative values. So this is what we are showing here. So these colors now highlight those places that are having more traffic than expected by the gravity model. And you can see again all of this area in the north part that reflects to the mining sector. And then this south part that has some bigger cities. To be honest, now we need to think why there was these anomalies in this region. For me, it's obvious the north, but it's not so obvious in the south. It might be because of like other activities, and that's also part of our project, is to disentangle what are the activities that are driving these anomalies or deviation from the expectation of the gravity model. And it is kind of inevitable to compare this with the SARS-CoV-2 transmission that is still going on in the country. So now I'm showing you again the provincias sorted from north to south, and time that span around 1 year. So COVID arrived to the country in early March, and then it has been expanding throughout the rest of the year, early March of 2020, and has been expanding for the rest of the year since then. Let me see the time. Okay, I still have a couple of minutes. So what we can see, and here I just want to highlight that Santiago, let me see. Well, I guess I can just point it out. Santiago is here. So Santiago is the capital, and then you can see that concentrated most of the cases at the beginning, but then it started to spread throughout the rest of the country. And here now I'm highlighting two kind of patterns that kind of surprised me, sort of. One is like, yes, we see a lot of cases early on in the pandemic in the north region where all the mining activity is happening, but also I'm kind of surprised by this pool here in the very south. So it might be that these regions are very small and still have more cases compared to the size of this region, or it might be because of maybe touristic activities or like other activities that we need to disentangle. Have to remember that Patagonia is a highly touristic area for Chile and has a lot of activities, and I don't really know if that has continued throughout the pandemic. And then, and this is important for the point I will make in a second, is that we see that after Christmas, right? This is December 24th, after Christmas, Chile has vacation during January and February. So that will be equivalent to July, August, June, July, August in the North Hemisphere. And we see that now the virus is spread throughout the entire country and has continued to rise. Like the cases haven't gone down yet, even though Chile has been very successful in their vaccination campaign. But that can be a discussion for another talk. So what we did here was to, and this was a very clever idea from Nishant, was to try to see clusters of mobility based on the Facebook mobility and see how they are associated with transmission. So what we did, well, this plot on the right is only showing travel from Santiago, but you can actually have a transmission matrix to all the possible locations. And by having that, then you can estimate or calculate what are the clusters of mobility based on this transition matrix. So that is what we did here. And then we look at how COVID has spread throughout these clusters. And it's not that surprising, right, that all places in Santiago here showing in the map, right, in red, that places surrounded Santiago have been very synchronized in the transmission early on, like in April, May, June, July of 2020, but also recently have also experienced this outbreak. We see also the same pattern here in the north. So the third plot on the top row are all these minery places that were aggregated together. And you see how it started early on also last year and has continued having cases throughout the year. Now, places that are far and maybe less of, that receive less transmission has been affected by the pandemic early throughout the year. And only during this year, 2021, we see a huge increase in the number of cases. And then there are patterns that we can explain less obviously, right? For example, here, it seems that they are synchronized, but it's not as clear as this or this other. But I found kind of cool that just looking at these clusters only informed by mobility, we can actually see synchrony of these outbreaks throughout the space and time. So this, well, is a plot that is not that easy to understand, but if we think in the basic reproduction number that has been estimated from the slope of the outbreak, and we sort them from north to south. So Parinacota is a region in very north, similar to Arica, Iquique, and Tamarugal. These are colored now by these clusters. And you can see that some of them are clustered, well, it's difficult to interpret, but we can see that values that like regions that have higher R0 now are closer to Santiago, and that the ones that have lower R0 are far from Santiago. So it kind of resembles this kind of C shape that we observed at the very beginning last year. Okay, so I discussed what we could, like how we can use Facebook mobility data, and it was good for us to create this hypothesis, like just looking and exploring the data, we were able to see that there is still a lot of movement to these regions, that some of them have highly economic activities, but there are still many open questions, and Facebook data in particular has a lot of limitations. So here I have some of the questions that we want to address using, for example, a survey. And some of them are, what are the reasons for travel? What is the duration of the trip? How many days are you away from home? How frequent do people travel, right? Because these mines have this system that bring people from other regions, because the regions where the mines are very small. So mostly from Santiago, but also from other cities of the country, they will have this kind of fly in, fly out shifts in which someone will go for 5 or 7 days and stay there in the mine and then go back to where they live. And they will do this on regular basis. So it's like a recurrent travel. And unfortunately, with Facebook data, we cannot disentangle whether it's the same person that is traveling multiple times or they are different people. Another important question is like, what is the actual path? Because with Facebook, we can only see transition from A to B, but then we cannot see whether a person goes from A to B and B to C. We will just see them as separate trips. So having other type of data, whether it's CDR data or surveillance survey data, it will allow us to disentangle some of these points. Another question is international travel, because we know from Chile that people, just looking at the cases, we know that these cases came from the very affluent, like rich neighborhoods of the Santiago, but we don't know where they came from and whether it was only of a particular region, and the reasons of people to travel, were they on vacation, were they on duty for work, etc. Finally, it will be interesting to understand the demographic and socioeconomic characteristics of people who travel versus people who travel for work versus people that travel for leisure. And we know from other works, and for example, a recent preprint that Caroline has on gold mines, right, in South America, that usually like people that work that maybe might be men in their 50s, may be more affected by these infectious diseases if they are the ones that driving the travel for work. Okay, so potential useful data will be Facebook displacement data sets, which have a closed cohort that has also information on international travel. Unfortunately, I think we don't have this displacement data set for Chile yet. Another will be to have, as I mentioned, demographic and socioeconomic information on travelers. And why this type of data might be useful is because of the crisis response, especially now, we are still in a crisis, and because we can use this information to disentangle the reason and mechanistic answers of the spread of infectious diseases within and across countries. And we plan to do a survey. We said, okay, let's do the survey in March 2021. But unfortunately, the conditions in Chile has been very bad, and we haven't been able to implement the survey yet. We do have the funding, and we are hoping to do it at the end of May if the restrictions allow it, because right now people are like in full lockdown. The country has suffered of a lot of cases recently, and this is a picture from today from Google that was updated 12 hours ago. And you can see that these are the number of cases since the beginning of the pandemic. So this is the outbreak that we saw in Santiago mostly last year, but now we know that the virus is everywhere in the country, and this peak is even higher, even though, well, there are external factors like the number of test capacity has improved a lot during the year. So this also reflects an improvement in testing. But while this situation doesn't change, I think we won't be able to conduct our survey. With that, I would like to thank Aisha Mahmoud and Nishan Kishore, who have been helping me, and the three of us have been discussing ideas on how to test our hypothesis and how to visualize it in a way that people understand what we are doing. And thanks to Crisis Ready for the grant that will allow us to conduct the survey, and Facebook Data for Good for the data.
Thank you so much, Pamela. That was wonderful. So if there are burning questions now, we'll ask them, but otherwise we'll ask it at the panel at the end. So we're hoping to have some time at the end, moderated by Nishant. Are there any immediate questions for Pamela? Please just unmute yourself and ask. Or you can raise your hand, or however you want to do it. We have one question. Is it possible to make kernel density estimates using the Facebook mobility data?
Can you explain a little bit more what you mean kernel density?
Go ahead, Akshay.
Hi, Professor Martinez. Thank you so very much for this very interesting presentation. I guess I was interested in just asking about kernel density estimates, specifically just because you mentioned the Facebook mobility data was related to probability estimates, and or I guess you were able to construct probability estimates from that. So I guess it's kind of like a way of just like estimating the probability of a certain like phenomenon occurring in any particular place. So I guess it was just like another way I was just interested in just seeing how probability could be like modeled over time using the data that you have of like certain occurrences, or I guess like certain people traveling in certain places.
Oh, well, that's a very good point. Thank you for that comment. I don't think we have considered that, but that's a very good idea. What the data we have from Facebook is just number of trips to a particular location within an 8-hour bin. But definitely here we use it as a probability, but definitely are better ways of using that, and it maybe inform the model to discuss further further like useful, how can I say, further uses. Well, yeah. Thank you.
Thank you. Really, those Chile is great because it's like so nice and like
it's 2D.
Yeah, it's 2D, and then you have the capital in the middle, and so you can really do some nice spatial analyses. Yeah. Thank you so much, Pamela. We'll come back to you. We're going to have the Amy and Stephen's presentation, and then we'll have a general discussion. So feel free to ask questions of Pamela during that discussion as well. Go ahead, guys.
Thanks so much. So I'm Amy Wazalowski. I'm an assistant professor in epidemiology at Hopkins. And Stephen, do you want to introduce yourself?
Yeah, I'm Stephen Klipman. I recently finished my PhD, and I'm an instructor in the School of Medicine at Johns Hopkins.
Thanks. And so we're going to tag team this and present some of the work that we've been doing and some of the surveys that have been supported by Crisis Ready. And so this is sort of a grab bag combination of a number of different things. So we've been running some surveys. And so we're going to talk a little bit, partially to give you some idea about some of the data that we've been collecting if other people are interested in working on any of it. Next slide, Stephen. So this work is part of a bigger project with a number of other people, including Shruti Mehta and Sunil Solomon, who are both at Hopkins. Okay, great. And so some of the rationale for when we started these surveys is really to try to get more detailed individual level information about mobility patterns, SARS-CoV-2 transmission, and really trying to be able to have an understanding of like the demographics for individuals, their risk behaviors, and positivity. And so there's been other surveys or other proxy data sets like mobile phone data, but we really wanted to be able to try to characterize mobility by demographics and then directly related to positivity that wasn't just reliant on things like symptoms. And so what we've been doing, next slide, please. So the objectives are really to sort of describe barriers and facilitators to SARS-CoV-2 testing, understand adherence and access to non-pharmaceutical interventions, characterize population level mobility and see how it varies by demography or geography, and then also to look at some things like holiday travel and what the impact may be on community transmission. Next slide. Thanks. So here are some of the methods of how we've been conducting these surveys. So we invited individuals across the US to participate in a number of serial cross-sectional surveys. We were conducting them roughly at 6 to 8 week intervals, with our first pilot one started in last July. We've done a number of different waves, with the last wave supported by the Crisis Ready grant, where we've sort of slowly been expanding out. So we've done a number of surveys in Florida, Illinois, and Maryland, but increasingly we've been expanding and working and adding in different states. So in general, we aim for between 5 or 1,000 people per state. We ask questions about demography, social distancing and masking, mobility, including do you travel, go to stores? Do you have any large gatherings? Do you go to the gym or indoor or outdoor? We ask about PCR testing ever and within the prior 2 weeks, and also information about if you have any symptoms, how did you get your test? Did you have to wait for it, and those kinds of things. We have added some additional questions depending on when we're doing it about travel in particular, like what did you do for Thanksgiving, those kinds of things. So we've been recruiting participants using Dynata. And what we do is we provide some quotas for age, gender, race, ethnicity, and income to match the distribution of the study states. Then Dynata is able to sort of find people to complete this online survey where there's additional security verifications and things so we can ensure that it's not the same person taking multiple surveys. And then all of the data were weighted based on the American Community Health Survey. So we're going to present some results that are from these different surveys, but roughly here's some idea about sort of what the geographic coverage is like. So we provide these targets and they recruit people from across the state, but we definitely have, skews where there's more people taking the survey, where there's more individuals, but they are designed to try to match those bins. So for example, if we have a target where we would like to try to get 3% Asian Americans in the survey, they'll sort of like change how they're recruiting different individuals to try to match all those different bins that we provide. Next slide. So today we're going to talk about some of the analyses we've been doing and some of the ongoing work. And we're going to talk about some of the work on testing access and availability, non-pharmaceutical interventions, sort of general mobility and everyday patterns, and then also talk a little bit about some holiday travel.
Okay, so I'll get started just talking a little bit about testing. To give you some context, these data that we're presenting here come from our latest survey wave, which was conducted in February 2021. Sorry, that's an error on the slide, as well as some cross-sectional assessments from July 2020 through February 21 in 3 states, Florida, Illinois, and Maryland. The testing availability in these states, there were both public and private options available. and all states had a free testing option at the time of survey. There were varying case rates, of course, and on the right-hand side here, we're just giving a little bit of a comparison between these 3 states where we'll draw longitudinal comparisons from. So in our most recent survey wave in February 2021, we sampled a little bit over 8,000 people, and 11% of people reported wanting or needing a diagnostic test in the prior 2 weeks, and 63% of whom got tested. We actually did not see any significant differences between states in terms of the number of people or the proportion of people who wanted or needed a test, as well as the proportion who got tested. The primary reasons for wanting a test were a positive household member experiencing symptoms or having a reported exposure, as well as people who needed to get tested for school or work. About 13% of people got tested before travel, and about 10% got tested after traveling. In terms of factors associated with getting tested, among those who wanted or needed a test in the prior 2 weeks, getting tested was significantly more common among those with a positive household member, among essential workers in healthcare, as well as those who were reporting recent travel. Again, we didn't see any significant differences by state here, as well as no significant differences by gender, race, ethnicity, whether the person was residing in an urban or rural environment, or by symptoms or exposure. So this slide here is showing the improvements in wait times with testing. We saw that the proportion of those tested increased from 52% to 62%, and the proportion of those receiving results the same day increased from 17% back in July to 45% in February. We also saw a marked improvement in the total time from wanting or needing a test to actually receiving those results. And that was 2 days or less for 56% of respondents in February, compared to 23% back in July. So overall, we've seen good improvements in these turnaround times for testing. So just to summarize, about 62% of people who want to test are getting tested, and these data reflect common barriers across 10 US states. In terms of people who wanted a test but did not get tested, the primary reason for that was not knowing where to go. And we didn't really see an improvement there. It was consistent around 26% of participants not knowing where to go to get their tests. We did see an improvement in turnaround times, but there's concern now about mass vaccination sites being used where mass testing sites used to be. So we're seeing this conversion of these testing sites into vaccination sites. And the concern, especially with circulating variants, might be how that impacts access to testing. I'm going to very briefly touch on NPIs just for the sake of time. Again, this is drawing longitudinal comparisons from Florida, Illinois, and Maryland. We saw that social distancing decreased a little bit in the summer. And mask use pretty much stayed the same. And we saw that that did not vary too much, but we saw that it was significantly higher among females, and those reporting Black race, they were more likely to wear a mask always. And we saw that always practicing social distancing was associated with a 50% decreased odds of self-reported SARS-CoV-2 positivity in the prior 2 weeks. We saw that always wearing a mask was associated with a 20% decreased odds of positivity, but this wasn't a statistically significant association. And the reasons for that are primarily because of how we're capturing mask use. And I think people not wearing masks, properly covering the nose and mouth. So Amy and another student, Sophie, looked into this a little bit further. And we, in our more recent survey waves, added more detailed questions on mask use. And we saw that there was this strong dose-response relationship when we asked people whether they take off their mask, whether they're at a restaurant or at the gym. And so this likely reflects our ability to properly capture this behavior. With the new CDC guidelines, of course, it's going to be important that we have clear messaging on social distancing and mask use. and potentially trying to enforce mask mandates in public venues. And now we'll move on a little bit to mobility. And this is coming from our serial cross-sectional assessments from July and October here. And Amy will touch a little bit on our most recent survey waves and holiday travel at the end. So we asked people how often they went to indoor bars, restaurants, gyms, hair, nail salons, going on vacation, or participating in outdoor group fitness activities. And we found that all of these mobility variables were highly correlated with one another. So here you can see a correlation heat map, and highlighted in yellow are these different mobility behaviors that we captured, and they're all very highly correlated. One of the things that we did, or that we were wondering about, is are there different subgroups of people who are participating in these different activities? So we modeled this using a network approach, and in this network figure, the connections are, it's visualizing connections with specific venues. So the unlabeled nodes here that are shown in gray, those are all participants. And the different nodes that you see in colors are different mobility activities and the connections to the participants that participated in them. So we ran a modularity analysis, which detects community structure within a network. And we colored the participant nodes based off of the community that they fell in. So we saw some distinct subgroups here. For example, if you look at one of these green nodes, these represent people who primarily went to the grocery store or visited their friends and family, but did not participate in any other activities. Whereas the purple nodes are people who went to the gym, bar, outdoor group fitness activities. And so just highlighting these different activities, not everyone was so cautious. So if you look at the grocery store, for example, we have these green nodes where people only went to the grocery store or visited friends or family, but we have all of these other people who participated in numerous other activities that you see in the blue, the orange, the red. And those are people that also went to the grocery store, but were highly mobile. So it makes it really difficult to disentangle this in terms of risk. And the key takeaway from this network figure is that while partitions of mobility behavior can be found, there's a lot of overlap between these clusters. So we can't really say precisely the risk of different activities. So one of the other things that we did is we mapped the participants who tested positive in the prior 2 weeks onto this network figure. And these are shown here in red. And so these participants who tested positive were primarily ones who were doing many different activities. They weren't just going to the grocery store or visiting their family. They were going to bars, to the gym, the salon, and whatnot. We actually found that 41% of positive cases engaged in all forms of mobility that we captured, compared to 1% of those who did not test positive. And this is another network diagram, but from our most recent survey wave. I'm sorry, not our most recent. This is from our December survey wave. And what's interesting is the communities that we detected here are slightly different. Now the grocery store and pharmacy is its own community, and visits with friends and family are its own community, which likely reflects the increased travel and visiting your friends and family over the holidays. One of the things that we wanted to highlight here was the increased likelihood of testing positive for every additional place you go. So similarly, within a specific mobility activity, we saw a strong dose-response relationship with frequency. So for example, whoops. Sorry, there was not an animation there. But we saw that there was this dose-response relationship with people who attended a gathering once or twice had a 6.69 increased odds, and that increased to 19.5 with 3 to 7 visits, and over 38 with more than 7 times. So frequency is really important here. So now I'm just going to turn it over to Amy to talk a little bit about mobility over the holidays.
Yep, and next slide, please. And so one of the things we were really interested in trying to use sort of this individual level data is that we can sort of run these surveys if we think that something is happening or something will be happening soon. So this was a survey that we did in 10 different states that was 1 to 3 weeks post Thanksgiving. And we in particular asked people about both what they did for Thanksgiving and what they were planning to do for the December and January holidays. And we also partnered with R2D3 to support some rapid messaging. Next slide, please. So we compared 3 different groups. So there were about half the people had Thanksgiving at home with only their household members. About 30% or so had Thanksgiving with non-household members. And, about a quarter of the people or so traveled for Thanksgiving. And in general, those who traveled were more likely to be younger, were less likely to live with an adult who was over 65 years old, and were more likely to be essential workers. Next slide, please. So when we look at SARS-CoV-2 testing, those who traveled for Thanksgiving were both more likely to have symptoms, get tested for SARS-CoV-2, and also test positive relative to those people who may have had Thanksgiving with non-household members, and which was also higher than those who had Thanksgiving only with members in their household. Next slide, please. So when we actually sort of dug into these different groups of people, so on the left-hand side, those are people who only had Thanksgiving at home with their household members. The middle are Thanksgiving at home, but had non-household member visitors. And the right-hand side are those who traveled. What we see is that those who traveled are much, much more likely to be positive, but it's not just that they were more likely to be positive, they were also just more likely to participate in a very, very wide range and large number of different activities. So there were people who reported like 35 different activities in the last 2 weeks or so. So this really suggests that like traveling alone, it's somewhat in combination with when you're traveling, you're also maybe more likely to go to a restaurant or go shopping or do all of these other activities that is sort of exacerbating the problem in this setting. Next slide, please. So in general, what we did see is that it's really this combination of those individuals who traveled, who also had a very high activity score, so who participated in a very large number and traveled to a lot of different activities. And these individuals were much, much higher. The odds was much, much higher that those individuals would have been tested positive relative to those individuals who did not travel or did not have participate in so many activities. And so what this analysis shows is that even if you are traveling, it might be helpful to sort of minimize some of the other activities you're doing while traveling to try to minimize the overall risk. Next slide, please. Thanks. And so that's just sort of some of the work that we've been working on a combination of the different waves of survey data now. And one thing that we're really interested in looking at are this like core high mobility individuals and seeing how consistent they have remained over time. These individuals who are just participating in a very large number of activities. Is it the same demographics of individuals? And if so, is that consistent across geography? And as the pandemic is different in different states and settings. And in particular, sort of combining this with some models of looking at if you always have these sort of highly mobile individuals, what can that mean for community transmission? Next slide, please. And so this is work, this is a plot from Alex Becker, who is a postdoc at Stanford, of looking at sort of in a very simple three population model, looking at if you have some proportion of your population that's highly mobile, sort of what it can be the impact on transmission dynamics, even if you that only represents 10% of the population or 20% of the population. Is that going to be enough that's able to sustain transmission in these different settings? Next slide, please. So just some of the limitations. So one thing that's always going to be a limitation is about representativeness. You know, this is an online survey, so it may systematically miss certain groups, particularly those who don't have internet connectivity. Another Previously, we've shown that this sample is comparable to random digit dialing, and self-reported flu coverage roughly matches the CDC estimates. Another issue is always going to be about self-reported responses. So while we're able to relate these data with their demographics and their mobility patterns and stuff, we're not confirming that these people actually tested positive. It's all self-reported. And also a number of individuals may have reported symptoms and things, but they didn't necessarily report that they were tested. So we can't really confirm all of this, all of the responses. Next slide, please. And just some of the key messages. So, keep wearing a mask. Vaccination is great. We can now go outside, and that's a good thing. But I think there's a number of things to think about, also about sort of like who's getting vaccinated too now, not just overall vaccination coverage rate. But what these results have sort of shown is that there are definitely demographic differences that are actually consistent across different states, and sort of who is who is participating in more mobile activities. And also we've seen in a number of these analyses, something that's like a dose response, where the more people are participating in different activities or traveling or taking off their mask more frequently, the more likely they are to be positive. So trying to figure out how abstinence only is not necessarily an effective or useful or plausible strategy, but thinking about harm reduction, trying to minimize some of these behaviors and try to minimize the community risk. Next slide, please.
Just to add one other more positive note is we did see in our most recent survey wave that those who were highly mobile and participating in all these activities, they weren't less likely to want a SARS-CoV-2 vaccine. So it looks like even though they're highly mobile, these people are getting vaccinated.
Yep, and that's all we have for you. So we'd like to thank Crisis Ready for having us, and all the different funders for helping support this work. Thanks.
Thank you so much. There was so much there. I think, well, we're going to open it up. Nishant, are you ready to kind of moderate? But if there are questions for Amy and Stephen, I mean, there was a lot that we could discuss this for a long, long time. I will hand over to you, Nishant, and you can manage field questions that are specific to them, and also think about a more general discussion.
Sure. Just right now, I'd like to open it up to generally anybody here, if there's any questions that they'd like to ask Amy and Stephen, or even to Pamela.
Hi there, I have a question.
You can go.
Is it open? Please go ahead.
No, you can go. I will ask mine at the end.
Thanks so much. Hi there, my name is Vinny. I'm a medical student out in Canada. Thanks so much, Amy and Stephen. This was really interesting work. I'm curious why you presented the odds ratios not adjusting for the other mobility types, because it's likely that people are mobile in different settings. And so I'm curious in that figure why you went that route.
Yeah, so one of the motivations for that was we found that because these mobility variables were so highly correlated with one another, that when you adjusted the odds ratios, your effect essentially went away. And it's just really hard to determine where those effects are coming from. So we decided to adjust it by demographics and state and mask use and adherence to NPIs. However, in terms of looking at it by different activities, we use that network approach. When we did analyses by adjusting for the community that the person belonged in, you could get a little bit better of an association there, but it was just really difficult to disentangle where these people were going because of the overlap between these spaces.
Got it. Thanks so much.
Pamela, did you have a question for them?
Oh, yes. There are two questions. One, I don't know if you mentioned the use of masks and whether these people that are highly mobile are more prone to wear masks or not. And then the second is you mentioned at some point that most of these highly mobile people were also essential workers. And I wonder if, like, that's because they kind of normalize the fact that they are traveling to work every day and doing their normal life activities versus someone that is at home working remotely 24/7?
We did adjust for essential worker status when we looked at these associations, but you're exactly right. We found that the people who were essential workers, or even the people who were not essential workers, but were working outside the home, were also more likely to participate in other activities in general. In terms of mask use, unfortunately, we did see that the people who were more mobile were less likely to wear a mask. And especially people who were going to bars, gyms, and outdoor fitness activities. The outdoor fitness activity was an interesting one because it was something where a lot of people participated in this. And I think people think that that is a safe activity, being in the park, doing yoga or something. But we found that that was really strongly associated with positivity. And most of these people were not wearing masks when participating in these activities. Amy, I don't know if you have anything to add.
No, that's exactly it. We also have found with the mask variable that we've changed it a number of times. It's really difficult variable to get. So we've done, general, and then everyone said they wore them all the time. And then we've sort of done it based off of activities. And do you take off your mask in these settings? Do you not? So now we've had it sort of set up that it's coupled with different activities. So do you go to the bar? When you go to the bar, do you keep your mask on when in all of those kinds of things too?
Here we go. We have a question from Joseph. You can ask it directly if you'd like, Joseph.
Yeah, sure. I was wondering if you found any direct relation between people who was using, probably they were mostly essential workers, using public transportation and getting infected or reporting symptoms.
Yeah, so we actually published a paper on this in Clinical Infectious Diseases. We saw really strong associations with public transport as well as attending places of worship very early on in the pandemic. These people who were using public transportation, I believe the odds ratio was around 16 or so. It was very highly increased odds of positivity in using public transportation.
Mm-hmm. Yes, and it was lower, but still really high for people who are attending places of worship. But then we later also realized that there was a number of services, at least in Baltimore, that were being provided there. So we have also sort of adjusted some of the questions as we've been going on to try to capture more of the nuance and why people might be doing certain activities and things.
Thank you.
Thanks.
A kind of a larger question for the entire group, including Dr. Bucky and Dr. Martinez and all of you. We oftentimes talk about having these like mobility data that are kind of automatically generated and available to us as a more real-time thing, and then validation studies. And there seems to be a bit of a gap there, right? It's not exactly the same cohort that we're getting both sets of data from. Do you think that's even feasible in some of the studies we're doing? What type of design would we need to be able to kind of truly directly compare these methods? And what are the barriers to making that happen?
I can say something. So this has been thought about for a long time. I think there are studies where they do this, like Matt Chiang's thesis project, right, where they used a specific app and they followed people and they asked to use their mobility data so that it was like integrated into the study design. When you use these large scale data sets, I think it's a little bit harder, but there are ways that you could think about trying to with consent get larger sample sizes. I'm sure Amy and I've talked about this a lot, and I'm sure she has something to say on it.
Yeah, I think it's like feasibly, it's a possible thing, right? You can run these surveys, you could have pinging surveys to different people. I think then as soon as you go in that realm, then you're going away from trying to get like big coverage of like very, very large areas and large numbers of people. And they go more towards sort of smaller scale things because you have to like make sure everyone stays in the survey and engaged and things like that. So I think it's feasible. I do think in certain contexts, explaining what the mobile phone data is collecting is not a non-trivial task to really make sure people understand what they're consenting to. But I think it's feasible to sort of do these kinds of studies. I think that You just have to have a lot of money and time. And like, yeah, lots of people who can help make sure all of these people stay in this study the whole time.
One of the things that we do have from these surveys, they were serial cross-sectional surveys, so we weren't necessarily targeting the same participants in each survey, but we did see a lot of overlap between surveys. So we have probably a couple thousand people who took our surveys at multiple time points. So we could look at how their mobility behavior changed over time, and we could maybe update the group on that.
Mm-hmm.
That's great, thank you. Any other questions from the audience before I continue to pester them? Okay.
Sorry, Nishant. I wanted to ask Pamela something. So Pamela, how do you think about your recent science paper, which congratulations again. How do you think about integrating some of the findings there more broadly across Chile? Like, is there a way that you think your surveys can start to address more broadly some of the kind of social justice issues for the modeling work or for the mobility piece?
Yeah, that's a great question. There are two things. One is that Santiago in particular is one of the most highly segregated in the city worldwide. Like the gap between the most rich people and the poor is huge. So I think that's why doing that study in a particular city was interesting. Most of there are not very big cities other than Santiago. Like when you look at the second biggest city, it's like 1/3 of the population of Santiago. So it's more difficult to kind of disentangle the same social inequality issues with other places in the country, but definitely it's doable. But I think what is interesting, and here we are in collaboration with Horacio, who is in Chile studying there, he is a faculty there, that is trying to disentangle more of this urban versus rural behavior. So maybe instead of just looking at social economic status, because more vulnerable, like poorer people in the south where there's just cows, they will have a very different lifestyle than a poorer person in the city. So I think that trying to disentangle what relates more to urban versus rural and how those may have connected with like income and like activities and economic status might be interesting.
We are 2 minutes out from the hour. Are there any last questions that anybody would like to ask our presenters? So great. I think in that case, rather than going over the hour, we can call it here and get a minute back. Thank you everyone for your presentations. They were incredibly fascinating, and I'm looking forward to continuing this discussion. Thanks all for attending. And yeah, we'll be in touch about our next event.
And the recording will be available at some point soon.
Yeah, and thank you for Crisis Ready for organizing this.
Yeah, thank you so much.
Thanks for coming. See you guys.